Hello everyone, welcome to my channel. My name is Dr. Aisha. I have recently passed AMC Part 1 exam with a very good score, and I have decided to start a series of lectures covering important aspect of AMC1 exam. So in this video, I'm going to discuss diabetes mellitus screening in Australia, and I have taken this information from John Murtagh. So first of all, um, the optimal screening frequency for diabetes mellitus in Australia is every 3 years. And when I talk about diabetes mellitus screening here, obviously I'm referring to diabetes mellitus type 2 because we don't need to do population screening for type 1 diabetes patient, okay? So the optimal screening frequency is every 3 years. So any person in Australia, after every 3 years, the GP needs to do an odds risk scoring for him or her, and if the odds risk score is more than 12, then the person will undergo a screening test for diabetes mellitus, which will either be a fasting blood sugar or HbA1c. Okay. So every single person in Australia, every 3 years, will need to undergo an odds risk scoring. So the GP will calculate odds risk for him or her. And if the score is more than 12, then the person will need to undergo either fasting blood sugar or HbA1c testing. Okay. But in certain high-risk groups, we need to do the screening annually. So the screening frequency will increase if a person is at high risk of developing diabetes mellitus. And high-risk group includes Aboriginal and Torres Islander people. So any Aboriginal or Torres Islander person who is more than 18 years of age will need to undergo diabetes screening every year instead of every 3 years. And then those people who are found to have prediabetes, which means that impaired glucose tolerance or impaired fasting glycemia. These people will also undergo diabetes screening every year. Okay. So now I will discuss in detail this flowchart that I've taken from John Murtagh, and it will cover all your MCQs about diabetes mellitus screening for MC1 exam. So first of all, the cutoff point for fasting blood sugar or random blood sugar is 5.5. Okay. So if if a person comes to a GP and the GP do odds risk scoring and it's more than 12, obviously the GP will do either fasting blood sugar, random blood sugar, or HbA1c to screen the person for diabetes mellitus. So the cutoff here for fasting blood sugar and random blood sugar is less than 5.5. Okay. So if both of them are below 5.5, it means that diabetes mellitus is unlikely. So you have ruled out diabetes mellitus, and now this person will go back to their normal screening pattern. So if they are not at high risk, which means that they are not um, Aboriginal or Torres Islander people, they don't have any significant family history of diabetes mellitus, then they will go back to their normal 3 yearly screening interval. But if the person is either at high risk of developing diabetes mellitus because of family history, or they are Aboriginal or Torres Islander people, then they will need to be retested annually. Okay, but for the time being, you have ruled out diabetes mellitus, and the person will go back to their normal screening interval, which will be 3 year for other people and 1 year for high risk groups. Okay, now if the fasting blood sugar is more than 5.5, but it's less than 7, which means that if it's between 5.5 to 6.9, or the random blood sugar is between 5.5 to 11.1, okay, then we are uncertain about their diabetes status. And if the fasting blood sugar is more than 7 and random blood sugar is more than 11.1, then diabetes is likely. So if the person is symptomatic here, that the person is having polyuria, polydipsia, and or have developed complication of diabetes mellitus like retinopathy, neuropathy, then you don't need to even repeat these tests, and you can just diagnose the person with diabetes mellitus based on this single result. But if the person is asymptomatic, he doesn't have any polyuria, no polydipsia, no weight loss, no other complication of diabetes, then you need to repeat fasting blood sugar or random blood sugar to confirm your diagnosis of diabetes mellitus. So for a symptomatic person, you don't need to repeat the test. If the values are like this and the person is symptomatic, you have already diagnosed diabetes mellitus. But if the person is asymptomatic, then you will need to repeat these blood tests to confirm your diagnosis. But if they are in the gray area, which means that if their fasting and random blood sugar are more than 5.5, but the fasting blood sugar is less than 7 and the random blood sugar is less than 11.1, they are in a gray area and now you are uncertain about their diabetes status. Then they need to undergo an additional screening test. Okay. So anyone with fasting blood sugar between 5.5 and 6.9, and anyone with random blood sugar between 5.5 and 11.1 will undergo oral glucose tolerance test, okay? Which means that you will give them a dose of oral glucose, which is 75 gram usually. And then after 2 hours, you will again check their random blood sugar, okay? So basically, their 2 hour post glucose load sugar, okay? So you're giving them a load of oral glucose, you waited for 2 hours, and now you have checked their blood glucose level again. Now, if it's less than 7.8, you have successfully ruled out their diabetes mellitus and they will go back to their normal screening interval, like in this case. And if their 2 hour glucose level is more than 11.1, then you will confirm the diabetes mellitus for this person. Okay. You don't need to repeat the test. You have already found out that their fasting or random blood sugar was in the gray area. You have done an OGTT. You found out that their 2 hour post glucose load level was more than 11.1. So you confirmed their diabetes mellitus status. Okay. But we have another gray area here again, which means that if at 2 hours the person glucose level is between 7.8 to 11. Now, this person is someone that we will call as pre-diabetes person, which means that they have impaired glucose tolerance. So what will happen here? This person will need to be tested annually. Like here, they will be treated as high risk and they will go back to the screening interval as a high risk person. So they will need to go to their GP every year to get tested for diabetes mellitus because now they are high risk. Okay. So this was all about diabetes mellitus screening. The numbers here, unfortunately, you will have to memorize them. So the cutoff here will be 5.5 for both fasting and random blood sugar. If less than 5.5, you excluded the diabetes. And the higher level is 7 and 11.1. If you find this and the person is symptomatic, then they have diabetes. But if they are asymptomatic and the levels are above the cutoff of 7 and 11.1, then you need to repeat the test, okay? If they are in this gray area between 5.5 and 7 and between 5.5 and 11.1, then you are uncertain, you need to do OGTT. Then here the cutoff is 7.8. If it is less than 7.8, then unlikely. If it is more than 11.1, then confirmed diabetes. But if it's between 7.8 to 11.1, then you have got pre-diabetes person or person with impaired glucose tolerance. So these values are something that you unfortunately need to memorize. I hope this was helpful and I'll see you soon with another video.